Musical stylings of all stars. I don't know if I don't want to say it's Leon Smooth Edwards, but definitely So Long, coming second to Renegades, I believe, that year. And some people that might be a headache for them, and that lends quite well into the topic that we are going to be discussing with Dr. Rohit Das, the medical or the MD of a Freeport Medical Center. And even before we go into the conversation, 673-1069, 791-8174, and it's 105 Mission Road, Freeport. But we are talking to the medical director and CEO at Freeport Medical Center, Dr. Rohit Das. Dr. Das, good morning. We're talking about headaches. When people say headaches, I want you to make the distinction between a headache and a migraine, thanks.
Yes, yes. Well, headache, first of all, headache is a big problem globally and particularly in Trinidad and Tobago. And generally speaking, a headache could affect any part of the head, but starting from the frontal, parietal, temporal, and occipital. So I will describe it as a pain in any aspect of your head. However, it still can be differentiated by two types. Headache that is caused by problems within the head.
And just before you continue, one of the things that we want to say, because I want to hear but you'll take me back from breaking down those different parts of the head. Also, we can say at this point in time, brain and sinus, brain and head, brain and orbit. These are some of the scans that are available. CT scans available at Freeport Medical Center. But yes, sir, continue again. Thanks.
Yes, yes, definitely. So if the problem is originate from within the head, we call it a primary headache. And if the headache is caused by a secondary cause, like let's say a patient has high blood pressure, it may manifest as a headache. If you have a sinus infection, commonly we hear patients having a tumor in the head or even an aneurysm, and it presents as a headache. So that's a secondary cause, but it's still a symptom of the problem. As opposed to a migraine, which is one particular type of headache. It is a primary cause, and it's referred to as a neurological cause of headache, and it comes on as a severe throbbing type of headache. First person who experience migraine will tell you, Doc, I have to go and lie down. It's so severe, it's associated with nausea and vomiting, and most times patients could say, it's triggered off by maybe not eating on time, or there's some trigger factor that we could find with a migraine headache. As well as the headache itself lasts between 4 hours, sometimes it could even go to days sometimes. And there is a photophobia. So patients want to come out of the light. They want to go in a dark room. Noise would make it worse. And then also when the headache eases up, there's a kind of prodromal phase where patients say, I feel nausea, I still feel tired, I need to lie down and rest. So migraine is one particular type, whereas headache is a general term for all the headaches that you can get, primary or secondary cause.
Those are definitions. What are some of the triggers?
Yeah. There are lots of trigger factors. From our experience, we find stress-related problems with trigger of headaches, and generally migraine headaches as well. Whether it be stress from work, family problem, financial, whatever the stress is, patients say that this is one of the main trigger factors. But there are other common trigger factors like not eating on time or skipping meals, not drinking enough water, dehydration, noise, loud noise, even bright light, like flashing lights. Sometimes patients who suffer with migraine, they tell you, I can't go out in the night because the flashing lights will trigger it off. Caffeine is a known cause, whether it's too much caffeine or withdrawal from caffeine, coffee. So, that's something we have to look out for. Dairy products, sometimes patients say, chocolates will trigger it off, milk, cheese, butter, these dairy products can trigger off headaches. So, there are lots of trigger factors. And also, of course, the secondary causes, as we said, this would be what general headaches like, other problems, sinus infections, air infections, etc. will trigger off headaches.
Okay. Trigger factors. So you may have a headache and you may say, okay, well, it's because I had dairy products, so it's because I did this or I was exposed to this.
Yes.
What's the rule of thumb, or what are your suggestions to say, okay, well, this is something I think I want to check it out?
Yes, that's an important point. Now, if a person, generally speaking, suffers from headaches and you've been diagnosed already, and the headache is getting worse or it's not going away, you need to see a doctor right away. From our experience, you need to get tests, particularly a CT scan, to make sure everything is fine in your head. If it's you're an adult or even teenagers, as the case may be, and you're getting a headache for the first time, it has to be diagnosed properly. So therefore, you need to see the doctor at that point, right? If, of course, if the photophobia and the sensitivity to light and noise and so on is not going away and is affecting you, or the headache is dragging on for too long, you need to get that checked out. And, of course, all secondary causes of headache. If your pressure is high, if your sugar is high, if you have a sinus infection, of course, anything related to tumors in your head, aneurysms, etc. All of these have to be treated. So really and truly, if you have a headache that is not going away, you need to come and see the doctor immediately.
You said all of them have to be treated, but what does that treatment look like?
Yes. This is real important. I'm really excited to talk about headaches because let me tell you, it's a condition we see very often at the medical center in Freeport. Lots of patients comes in. Sometimes for the week we see lots of patients with this problem, right? And first of all, the patient has to be diagnosed properly. And in the diagnosis, the doctor will go through these questions by interviewing the patient to see if the headache is a primary, like if it's a migraine, if it's tension headache, if it's cluster, if it's a primary headache, or if it's a secondary headache. And then, of course, when the patient cholesterol, check blood pressure, check the sinuses, you have to do these tests. Essential in that investigation is a CT scan of the brain and sinus, right, which is available at Freeport. And once a patient is diagnosed properly, I have put in a procedure where patients has to be treated according to 3 modes of treatment. One is we treat the headache immediately, so give the patient relief immediately with injections, and we use strong injection based on the intensity of the headaches. And then we put patients on medication to prevent the headache from coming back, so that's a preventative way. And of course, all patients who have trigger factors, we mitigate and treat the trigger factors as well too. So it's a procedure and a protocol that we have that we follow to treat these types of headaches.
The first person I know excited to talk about headaches, but we've spoken about diagnosis, we've spoken about treatment. I'm sure there are people very excited to hear how do we prevent the headaches from coming back, especially if you have an idea what the trigger causes
factors, yes, definitely. And that is, you're on the right track. Once we diagnose a trigger factor, the thing is to avoid the triggers and, of course, to mitigate. So, whatever the trigger, let's say patients, a common one is not eating on time. So patients say, Doc, I missed lunch and 2 o'clock the headache come on. Please, you have to try to mitigate the trigger factors, right? Healthy living, like, eating on time, eating healthily, drinking enough water for the day, getting enough rest. Insomnia is a main cause of headaches. Exercise, these things, and of course, again, the secondary causes, we have to treat them.
And I want to move away from headaches for a moment, because coming up on the 17th, there's an event. We didn't necessarily get to speak about it last time. So please, walk around for a healthier you. What is that?
Definitely. Well, Freeport Medical Center, one of our main objectives is to give back to the community. And one of the ways that we do that, we have the free clinics on Wednesdays and Fridays, and then we have our regular outreach program. I think a lot of the viewers may remember we had the She Drive, which finished just in July. It was an enormous success. And now on the 17th, we have our outreach program, which is the Family Day and the Health Fair. It is starting in the morning at 8 o'clock with the 5K, which is Walk or Run for Healthier You, and it's ending at the Arena Savannah. And from there now, we're going to have the Family Day, and with lots of games and so on for children, and we're going to have booths set up for the health fair where we're going to be doing screening and seeing the doctor and so on. All of these are free, of course.
So definitely you could find out about the CT scans, you can find about other packages that you have. But going back, in terms of like CT scan, because once again I see brain and sinus, brain and head, brain and orbit, and there is that urge to not suffer in silence. But in the closing moments of this conversation, Dr. Das, what would you want to let people know in terms of, especially people who might be struggling with headaches?
Yes. Yeah. I would say that headache itself could mean a lot of serious problems, right? It can mean a tumor, it can mean a sinus infection, it can mean an aneurysm. You have heard it in the past. We at Freeport have the experience and all the diagnostic tools to diagnose the patient properly. Once the patient is diagnosed, then they can be treated. So I like to tell persons, persons who have headache, suffer with this problem, we at Freeport are very experienced. We have been doing this for many years, and we are quite capable of dealing with these problems, especially the diagnostic side and treating these problems.
Dr. Das, I think I want to steal some time because I now see some of the prizes for the Healthier You, and I wanted to go into the prizes and also give me an idea of some of the packages that the Freeport Medical Center would have. Thank you.
Yes, definitely. Well, the prizes, we have been trying to, in the sense of giving back, that's one aspect of it, but we're also trying to make sure that people feel it's worthwhile to attend at the same time, right? And so some of the prizes are along the medical field. So we're giving a cash prize for first, second, and third, male and female, as well as a full medical. So patients will be getting a full medical for the first prize of worth $2,400 plus $1,500 cash. That would be the first. Second, a full medical, $2,400 plus $1,000, and the third, a full medical worth $1,500 and $500 in cash. Plus, we also trying to attract like the elderly. So we have a prize for the over 60 and prize for the between 50 and 60, and then the children under 12, boys and girls. So it's along the line of that, and we find that it's coming along very successful. So far, we have over 400 persons already registered to attend.
We're just looking at that first prize alone, and then even the fact that the first child 12 and under, they're getting back to school voucher and stuff.
Yes.
And if people want more information, once again, they can call 673-1069, or you can use WhatsApp 681-8174, or just go and get some more information. And this is 105 Mission Road, Freeport. And once again, really want to just commend the fact that you are in the community and of the community and giving back to the community. Sometimes people in an area, but people be like, me, not me and them, no? That's definitely not the case with Freeport Medical Center. No. So CEO and Medical Director of the Freeport Medical Center, Dr. Rohit Das, we want to thank you so much for the time and the insight and just the work that you're doing. And we want to thank you for tuning into the Now Morning Show. We continue after this. Stay with us.